Good morning. It's Friday, August 16th, so it must be time for another update from your North Carolina Medical Society. Yes, we are still in session. So if you recall, the Senate was gone last week, so they were back this week moving forward some legislation, as well as the House moving forward some legislation as well. So first, I want to point out to you Senate Bill 86, the Small Business Healthcare Act. And this is a bill that we've talked about several times. It's the Association Health Plan bill that we made changes to make sure that it did not impact the North Carolina Medical Society's MEWA. So that change was made. So this bill was passed by the Senate and is now sitting on the governor's desk. So we'll wait and see if the governor decides to sign or veto this bill. Next bill I want to talk to you about is Senate Bill 681, and this is the Rural Health Loan Program for hospitals that we've also talked about several times. So the Senate voted not to concur with some of the House changes. So what that means is that this bill is going to go into a conference committee with members from the House and the Senate to discuss some of those changes and work out a compromise type solution to see if there is a compromise solution that both the House and the Senate want to move forward. So to be determined what conferees are nominated to discuss that bill and if and when it'll move forward. Also want to point out a bill that was completely changed this week in the House Health Committee. So a mini truck bill was calendared for House Health, but this bill turned into the birth center licensure bill, so one separate bill that we've already seen filed this session, and then a pharmacy benefit manager bill that we've also seen filed this session. So those two separate issues combined into this new bill, so that is no longer the mini truck bill. So for more details on that, both versions are slightly different than the ones we saw filed earlier this session, but of course two separate issues, now one. So visit our blog for all the details on those proposed changes. And again, also we're getting to the point of session where things are starting to pile on. A number of public health issues are piling on to one or two bills, so be sure to check out our legislative blog for that. It's been a quiet week with the legislature going to a legislative conference this week as well. So hopefully we'll see a little more action next week. We'll be sure to keep you updated. Hope you have a great weekend.